The UK has opened up its borders for people to apply to come into the country under these different schemes. Actually, there are quite a number of them. Many people are not really aware of those schemes. Ever since as you already know, we Brexited from Europe, from EU, actually, European Union, I think sometime 2020. And ever since then, UK has been creating a platform that will bring in people with good skill sets to come into the country to work in different capacities. And they created a scheme, one of the schemes which is most popular amongst the lot has been the skilled worker visa program, which is looking at bringing people who have certain skill sets to work in the UK in different capacities. There are a few other schemes out there, which might not fall into the remit of today's discussion, but I will focus more on the skilled worker visa program. I think this is where most of you are interested in today's webinar. The skilled worker visa program has created a level playing field for most people all over the world who want to work in the UK. It's a work-related visa, so it's not a tourist visa, or as you might call it, a visitor's visa, which doesn't entitle you to do anything. Actually, you can work, you can do anything. This is a much better visa, and because it's a visa which gives you that opportunity to get your permanent residency, and also gets you your British passport to remain in the UK and work legally. Is designed for people who have certain skills to come to the UK for a period of 5 years and to work in the UK, linked to a particular employer for a period of time, after which you're entitled to get your indefinite leave to remain and then apply for your British stay, your British passport, so to speak. So the role entails different people with different professions. You're looking at engineers, looking at architects, you're looking at roles like teachers, you're looking at roles in the health sector, you're looking at people within roles within the care sector as well. Very many roles. It's quite listed, it's plain black and white. UK has, if you go to the website, you see most of those roles which are available for sponsorship. Now, what the role entails is that before you can come into the UK to work, you must have been gainfully employed, and that seems to be the hardest aspect in the whole process, and that's what we support you. You have to be able to be gainfully employed, and you also secure a sponsorship license or certificate of sponsorship from the employer, which enables you to work in the UK under different professions. So the sponsorship license is more of like a home office reference number, which is linked to you, which the employer applies to home office with a fee, and they give you like a reference which it's allocated to you. If you want to change jobs, you can always get a new reference number from a new employer. So as I said, it will cover different professions, wherever stage you are today. But it does cover, it's not just about you having a degree, but it's more around what currently you're doing in what capacity. And it's very, very important. So one thing we do, we help people to rebrand their CV, because it's very, very important to, okay, I'll just put the mic close to mouth as well, just in case. Out is better now. I'm actually by the sea, but anyway, it just creates that opportunity for you to come and work under different capacities. So one of the areas which a lot of people have been looking at is the health and the care sector. That sector is particularly very important because apart from being listed among the list of eligible jobs, it's also among the list of jobs whereby there's shortage of available skills, or people are not interested in doing those kind of jobs in the UK. The health and the care sector is a very, very important area. You're looking at roles with medical doctors, nurses, dentists, psychologists, physiotherapists, healthcare assistants, care workers. Quite a number of those roles are currently available, and they are listed among jobs whereby there is a shortage of available people that will take on those roles. So, which is very good. That has created a good opportunity for people abroad to apply, not just people in Africa, people all the way down from Asia, people from North and South America are applying for roles. So it's quite a very competitive uh, um, um, uh, roles, actually. That's why one thing we encourage our clients to do is to have a very, very good CV that's up to UK standard. So the first thing I get encourage your clients to do, so I will talk to people who are looking at the care workers. I will then talk briefly about those looking at community workers under the other medical area. I gather there's some people who are looking at the care option, because if you're looking at roles like some of you might be starting the whole process, and you are basically you want to know about it and what does it entails, how can I get into this role, into the scheme. There's definitely ways you can get into it. One of the things what we start doing, encouraging our clients to do, will be to have the right training, have some training around it, because the roles are competitive. Someone told me, is the role saturated? I won't say it's saturated, but I would say that it's competitive. Many people are applying for it. But people are still getting jobs. People are still getting interviews. More and more, I've seen more and more care agencies or care homes have applied for their license in a bid to be able to recruit people from abroad. I've spoken to several care home owners, and they are in the process of getting, because if you see, they want people in different parts of the UK. They can't get workers in country. They look for people from abroad, which they want to sponsor. So that's one thing we do. We try to share a list of people who or agencies who are just getting their license. Who are just getting their license so they can apply. Sorry. Okay. So it's very important because the role is to show the occupational list if we're applying for roles. So one of the things we get to do will be to do the training. It's very important to do some form of training that will give you a level 1 training at least. Level 1 training on care. We run the care training program, and one thing we've been running that for some time now. That will give you a level 1 training experience as regards care. It talks about different, I think it's a 15-module course, and covers different aspects of care. Once you complete that, you will get a care certificate from the UK recognized academy. That will help your CV, because it's good to have some certification around that. Secondly, once you complete the course, you'll be to do an assessment, after which you need to get like so it's very possible once you complete the care training, you will get like a care certificate from UK Recognized Academy, that which you would then need to put in the CV. Secondly, which is very important, is to get some form of experience on your CV. You might not have anything related to care. You might be from a totally different background and say, how do I get around this process? Let me know if you don't have any. What we do, we could recommend some places you can go and do your care or care training. It's more of a practical experience, so that it will reflect on your CV. It's very, very important to do that, because if you apply for jobs without the right experience on your CV, you will never be called for an interview. So it's very important that you have that. Once I started this process, I realized that there were several care homes, so they call them old people's homes could be Nigeria and Africa, quite a number of them in different parts. So get some physical experience. It will help you in too many ways. One of them is for practical experience purposes, because when you do an interview, they will ask questions. So it's not like this role is not like you walk in the park. You have to go to an interview process, and they will ask you questions based on your knowledge, on your skills. And then you'll be able to determine whether this role is something that you'll be able to do in the UK. So without any experience at all, practical experience, it's a little bit harder. And also, so you know what you're getting into. I've had cases whereby some persons come into the country and they find a job. Oh, I can't take off an old person. I can't take off an old person. Say, but hang on, me. You claim you've been working on this role for some time. Why would you not have experience in in working with old person, or you don't like cleaning with old person, and that's a little bit, it didn't make any sense. So it's good to have that, you know, what you are getting into. Secondly, is for reference purposes, so you can reflect on your CV as if you have some experience. So at that place you work. So what we do is that when you work with a care home, you have some discussion with them, so you can reflect on your CV as a care assistant, and some of them are even willing to help you with additional references, so that everything will reflect on your CV. Once you have done that, one thing we do, we will help to revamp your CV and to bring it up to UK standard. Because if you apply based on a Nigerian-centric type of CV, most likely you still not be called up. So many CVs they've been applied for months and months, but still, the CV is still very, very Nigerian-centric. They'll tell us, "Oh, I'm married, I'm have two children, I was born in this age." All things that will make people discriminate against you, will strip them off, will put some achievements, ensure that your CV stands out. Very, very important as regards the process. So once you are ready and your CV is done, we will then show you places you can apply for jobs. We don't apply for people just to get a clear, because we feel that if you want something, you go for it. We had a testimony the other day from one of our clients, and she actually echoed the same thing, not because I told her, but she echoed the same, that it's better because you are applying for the job. The application process is all part of the experience itself, because you are reading on job description, you're looking at, oh, this is what it entails, you're preparing yourself. When you apply for more roles, you are getting yourself prepared. You're getting yourself prepared for those type of opportunities. And when it arises, you are better placed to be able to secure the job. So we'll share with you places like care homes, recruitment agencies, places that are currently recruiting. But I don't want you to stop there. I would like to do your own bit as well. We'll share with you some other recruitment sites where you can also register your CV and also get constant reminders of new opportunities when it comes into your inbox. You apply for them as quickly as possible. So when you get an opportunity for an interview or query as regards an application, let me know. Feel free to drop me an email or a message on WhatsApp. I'm happy to provide clarification on it. And if you have any form of, if you have a job interview, also let me know as well. I'm happy to share with you some form of interview tips and possibly run through a mock interview for you, just to get you ready and get comfortable with the interview process, provided I have enough time. So that's also very important. When you get the job and sponsorship license from the employer, one of the things we'll do is to run for you a visa consultations, or guiding you on the right documentation, or do a full eye check on the document, ensure everything goes smoothly. And before you start the application process for the visa itself, we're happy to guide you on that regard, so everything goes smoothly, you don't fall short on the last hurdle. So that's a nutshell of what we do in terms of guiding or consultation. So more around hand-holding you throughout the entire process from start to finish, so that everything goes smoothly. One thing I want to make sure that I want to just explain, that it's not like it's a walk in the park. There's a lot of things you have to do. It's a process. This visa is valid for 5 years. There's a 3-year, there's a 5-year visa, depending on what the employer wants to give to you. But it's so much better than most of other visa schemes out there, because it gives you access right to work. It gives you the ability to bring your family along with you to the UK, and your families will also have the entitlement to be able to work, in fact, without any problem. You can travel out in and out of the country at any given point in time without any restriction. The only thing you might not have is access to public funds during the 5-year period, which you don't really need, because you already have a job already. And the average pay, you're looking at the minimum requirement for the UK visa is £10.10 or £10.10 per hour, or looking at 20,480 minimum pay. So if you come with a family and a get job as well, both of you, you and your spouse also will be very comfortable. I have people who are doing this job just like permanently, and they're quite comfortable, very, very comfortable. And You can do the career path in it in area of healthcare or care. You can grow from become a care worker to become a senior care worker. You can even proceed from there to go and become a you can go to school again and do nursing, or some with time they can become a recruitment agent and recruit other care workers because there's a high demand for people. So there's a job opportunities for them in that area. Some persons progress over time to own their own care home, and care agency. So all these are a lot of opportunities. I have several people who like that who we work with, who started as just care workers. Now they own their own care agencies and they recruit for the government in different areas, and they're multi-millionaires today, and they're very, very comfortable. So it's a career path. You start small, but there's a progress, there's a way to grow in this process. Like I said, some of you might already be applying already saying some trying to apply, or some of you are not. Some of you already maybe they are nurses, or some of you might be doctors. The process is slightly it's almost the same, just that you might do the care, no need for the care training online or the care training because you already have a practical experience already. What we need to do just to help you to revamp your CV, which is very important, and show you places you can begin to apply for jobs. For those of you who are looking at who are in this conference, and maybe you are already in a healthcare professional in that area, or you're already a nurse already, or you are already maybe a doctor. For the nursing ones, for instance, it's a little bit challenging to enter into the country to work as a full-fledged nurse because you need to register with the Nurse and Midwifery Council. You need to complete your IELTS, I think, with a pass of about 7, which a lot have had some challenges in getting be successful in that area. If you have been having challenges, we could explore coming and apply for roles like a senior care worker, healthcare assistant. I was talking to an agency recently, and we'll be getting far into this discussion. They're looking at they want to provide senior care workers who have some nursing background. And I've seen so many cases like that who have been successful coming. And when you're in the UK, you can afford to, after working with some time, upskill yourself, register with the NMC, UK NMC, and get your progress from there, to become a full-fledged nurse. And the same thing with our doctor friends who might be struggling to pass the PLAB exam. You can progress from there, come in at a slightly junior level, more like a healthcare assistant type of role. And then from there, you begin to proceed coming. You can now write a PLAB exam while in the UK, and you can now progress from there. Some of you might be already applying already, and you've seen some other additional requirements. So I'll just go into some other requirements, maybe more on the visa side, or what will be seen over time in terms of the application for jobs. What we've seen sometimes, some of the care homes who will recruit ask for a little bit more than the typical visa job, just a CV. So asks for things like, will provide me with a driver's license. Do you have your IELTS exam? Do you have sometimes they ask for tuberculosis and police report and stuff like that. So I see some people, some of our clients already have everything already and just good to go, which is it's good. Anything that makes you to stand out, anything that makes you to stand out in terms of the whole process, I will encourage you to get it. It costs some money. They are not most expensive things, but I think they are achievable. I'll encourage you to go for it because this visa will drastically change your life, and that's what I would advise. The issue of the IELTS is one very common question. Do I need to write the IELTS exam? Recently, it's been talked a lot online just to write the IELTS. It became so popular, and the demand for IELTS has been so much. But of late, I've spoken to a few colleagues of mine in the UK and some counterparts who are into a care agency. I have a friend actually who's a care agent, who runs a care agency, and he's been able to bring people to UK without writing the need to write the IELTS exam. And I had a good look at the UK VI requirement in terms of the visa documentation. It does say that if you have an English language, so one of the requirement is if you have the IELTS passing the CELT exam, yes, that's one of them. If you have a UK degree, what I mean the bachelor's degree, that is taught in an English-speaking country that is known, it will qualify as an English proficiency. If your country is in doubt, maybe you're schooled in country like Cameroon and you maybe did the English language, but meanwhile it's popularly speaking country, is the UK their advice is to get a clarification from bodies like ECTIS, ECCTIS, with your BSc certificate, with your transcript, and also with a letter from the university to confirm that the medium of communication is English language. So with that one alone, they will give a waiver and more, I give a confirmation, which you can use for embassy purpose. But if your country is largely speaking, like in Ghana or Nigeria, I'm quite comfortable that you don't need, because I've had some clients which we are applying their visa for them right now. I have a few of them from Nigeria, and one of the requirements stated there is if you have a UK degree, if you have a degree that is taught in English language, that is one of the requirements, to prove your English level of competency. So that's about the quick summary for me. There are other professions which also are available. If you are like an engineer or you are a teacher, there are certain requirements you need to fulfill though. We still help people in the same skills. It doesn't have to be care or health. There are other professions which we're also working with as well. We have someone who was a compliance that came to the UK early this year. And we have people in IT who are exploring the IT route coming to the UK. I've been teaching, but teaching has its own challenges because it does require you to be registered as a what they call the QTS, qualified teacher status in the UK. So it has its challenges, but I'll talk to you if you're looking at those areas separately. So I think I will make a stop now and just entertain some questions from anyone. Maybe feel free to put your questions on the chat. Let me read the questions on the chat. I think there's a chat box there. Let's see the chat box. Instead of reading your questions out loud, just put the questions on the chat box. Let me be able to read the questions, then start looking at the questions that you have. Is that okay with everyone? Yeah. So thank you for that. Someone said, is it compulsory to have COVID-19 vaccination? No, it's not. It's not a visa requirement, so it's not compulsory to have COVID vaccination. Now, UK doesn't even check for COVID. Doesn't even check for COVID. I'm currently on holiday right now. We travel the country coming back. They don't ask for anything at all. Someone said, how much do you charge for the service? So charges is differ. So I'd rather you for people who are just starting the process, it varies depending on your journey into the whole process and what you're looking at. So it tends to vary from person to person. But on the average, you're looking at a maximum of about 150 in terms of naira. But it depends on where you are dialing from. If it's in pounds and dollar, it all depends. So let me know what it is and where you are in the whole process. I'll let you know what the applicable charge will be. I have someone said, give an overview for IT routes. So from the IT space, there are different. So there is, I had a client. Let me see if I can pick up. So on the IT side, it depends on IT is very broad. So if you say IT is so broad, IT you could be on the hardware, the software, you could be a server technician. So it's just a matter of it's such a very broad topic. So maybe it's something that we could explore. I was talking to a friend or a lecturer recently, and I looked at a few roles in IT. And one of the things I talked about, I shared him a screenshot, and they were looking at roles within IT project managers, IT business analysts or architectures, program software developers, web design, IT consultants. That's so broad. So you could reach out to me separately. We could discuss that. Know your skills and know what best plays. Those already in UK, is it possible for them to get sponsorship in any care home? If yes, what does it cost? Yes, it's very possible to get. I have a few clients already residing in the UK who are like students, and or some of them are dependents, and most of them are students anyway, and they're finishing their program, and they are exploring converting their visa. It's slightly cheap, it's slightly easier. I would say it's easier because the cost of the immigration surcharge is quite expensive, and like when you're in the UK, it's better for them to have it's easier that way. So feel free to reach out, Mr. Craig. I'll talk to you about the course. I need to know where you are today. Are you really working as a care worker or something different? So most of the time, I like to get one-on-one to know where you are on the journey and best ways to advise you. So I asked, is IELTS compulsory? I think I've addressed that question already. I said English language is compulsory. IELTS is not compulsory. It all depends on your current situation. If you have a degree taught in English language, that would suffice. So I think I've covered that already. Yeah, IT technical support. Feel free to reach out to me separately. I could check for you whether IT technical support is there. I would say maybe not support. Maybe it could be something relating to. I could share with you the list, and you can have a look and see what you could fit into that. Please, can someone who studied education government in Nigeria be accepted for care workers? Like I said, it won't work based on you study education or you, even if you study education, doesn't make a difference. Most part is what do you do in terms of work? Yeah, you have education experience, but what would you have to run a care certificate? That's why we run the care training certificate for you. Then we need to do the volunteering experience, which I talked about as well. So that will give you the experience on the CV. So that will sort out the issue of experience, and you can reflect all the experiences also in your CV. So after the IELTS exam, what do I do after that? So IELTS should not be your problem right now, to be honest. It's more important to get the right training done, the right CV revamping, the right experience. That is the most important thing right now. I think I've addressed the issue of the IELTS also. So I move to the next question. How much would you charge? I mean, from Nigeria, I have my passport. What is the next step for me? The care training is the next step. If you already have some experience already, the care training should be the next step. If you are just starting on the process, yes, you need to have your passport. And quite my clients also get your driver's license. That's the international driver's license, because I find that a lot of domiciliary care homes are looking for people with driver's license. So if you have, it's not a full-fledged UK driver's license, but it allows you to drive in the UK. So I've made a case to some of my clients who are working with that. Yes, this person can drive because they have an international driver's license. So yes, feel free to reach out to me if you want to start the process. Why not? Once I don't have a medical degree. I have a degree in education in Nigeria. Any opportunities for me? If you have a degree in education, it depends on what. If you have a degree, are you teaching if you're teaching secondary school, there's an opportunity in teaching. If you're not teaching, then the best route is to go for the care one. I have people who are exploring both in terms of teaching, also exploring the care option as well. The teaching one is a little bit harder because it does require you to have a QTS certification, more like a teaching qualification in the UK, which is proving to be a little bit challenging for several people. But yet, we're happy to discuss with you more than that. But I advise you to go for the care route. That would be much better because opportunities are there. The visa is a lot cheaper as well because demand is high. So I think that should be, when you come to UK, after work for a few years, you can always change your visa and get in the job. And so Patricia's asking, for those in Nigeria, how long will it take if all conditions are met on the part of the person requesting for the sponsorship? So yes, if you meet all conditions, it takes a while to meet all the conditions. I will be honest with you. It's not something you get all at once. It takes a while to get all the conditions. So most important thing, like I said, get your training done, get your work with your CV work experience, get your CV done properly. I'm happy to share with you like a step-by-step guide. Reach out to me personally on my number. I'll share with you step-by-step guide. Get a driver's license by default. Start applying for jobs. Once you start getting tractions for it, then you're now looking at, because the issue of tuberculosis and police report, these are visa requirements, not necessarily job requirements. Though sometimes you see some care agencies asking for this, but technically they should not be asking at this stage. When can we start the course and get necessary certificate? Precious is asking that question. We could run the certificate for you within 24 hours, you'll be online to an online portal, and you can start doing the course itself. You could do the course for say 2 to 3 weeks, depend on your time you devote to it. I have persons who finish it within. I have a lady, she got 100%. And just amazing. She blew my mind that she got 100%, and she did the course less than 1 week. I think actually 5 days. She got the course in 5 days, and she got 100%. So that means that person put in a lot of time into that, And meanwhile, some person are doing it for 1 month, and they're still telling me, "Oh, can I do the course? Can I do the exam for them, or do the assessment for them?" So it all depends on the individual and how serious you take the process. And the whole process itself can take between 2 to 6 months. 2 to 6 months on the average. It can take longer than that, depending on when you get a job, to be honest. Jane's asking, I study sociology and planning on getting a professional certificate on healthcare management. Okay, on healthcare management. And what are my stakes? You get is on healthcare management. Yes, you could get a certificate on healthcare management. That will also add to your certificate. Like I said, not certificate you gain is wasted. But I think before you get into management itself, you must be able to know the work itself. So before you learn to run, you must learn to crawl. So you best to do start from the foundation, do the simple care training certificate, very important. And that is where you start from. And that's what I advise you to do. Head is asking, I'm in Nigeria, a registered midwife. How do I start the process? How long does it take? Would love to come to UK and work as a caregiver. So Helen, yes, the process is how to reach out with me. Like I said, you might know you will need to do any care training. You already have it. You already have like a level 6, 7 care training. So you're already on top of that. If you are open to writing the resident with NMC, UK NMC, you feel free to do that. That takes a long process, but you have to write the IELTS as well. Otherwise, you come into the UK as a healthcare assistant or senior care worker, or looking at a nursing assistant. Those type of roles you could come into the UK. Feel free to reach out to me on that. We'll be happy to discuss. He said, Ms. is asking, where can I go and have the practical care work experience, please? Museum, it depends on where you are based. If I'm not sure where you are dialing from, but if you are from wherever, you let me know where you're dialing from. When you need that practical experience, let me know. I'm happy to provide you some contacts just to guide you in that regard. That's what we do for our clients. I'm into healthcare line and auxiliary nurse into the training already. So which CV are you talking about? Okay, fantastic. So it's I'm into health line, auxiliary nurse, and into the training already. Yes, you might be doing that. Like I said, some of the CVs I've seen today, they are very Nigerian centric. They don't write the CV well. It's not done. I've hardly seen to date. I've reviewed over. I'm sure I reviewed over 100 CVs. I'm yet to see a CV that I'm just comfortable with that. Yeah, this CV is done. I don't need to into the CV. I'm yet to see one CV that achieves that purpose. Most of them I've seen today have been very, very Africans or Nigerian or Ghana centric. It's so not UK style, so that needs to change. So that's one thing we have to do for you. So the CV has to be upgraded and revamped properly because it captures so many irrelevant things which should not be there, and things you put in, it's never written properly. That's why. I can see Fatima raising a hand, but I have to look at the putting your questions in the chat. Speak up for me to just pick it up from there. I have quite a number of them already. Please, can you give me? Jay John is asking, please, can you give any overview on business management? Or that is for those who want to come in to do a BSc or a master's degree. Can you please put your, sorry, if you're coming to work in the UK coming as a student route is a entirely different process and a lot longer. Yes, you could, but it's expensive, but it's a little bit easier to get, but it does cost a lot of money. Just to bear that in mind, I'm happy to share with you some of the documentation for student visa, but it's quite expensive, costing millions. So if you're from Nigeria, Naira, so just to bear that in mind. How much will tutor package cost for a single mom with 2 kids, 7 and 6? That's pretty. If you are looking at a single person coming to the UK, this scheme, maybe aside your tickets, maybe looking at 600,000-700,000. It won't be less than that. If you're adding your 2 kids, you're looking at maybe 1 million or so. So it's not a very expensive route, to be honest. But you don't have to pay everything once, because you get them in batches when you need to get things gradually. So I don't think the money should scare anyone. It's a lot more affordable option. It's a little bit harder to get. That is why Africa is not empty by now in being the UK. It's a little bit harder to get. I won't lie to you, but the reward itself, it's life transforming. Okay. I can see an iPhone. Okay, say I study guidance and counseling here in Nigeria. Currently working in librarian school. In librarian in a school. What next? I think I've drafted that. If you would depend on what you want to do, librarian is not among the jobs listed among the skilled worker visa program. So you have to go. I think I will advise the care route will be the best one for you, because I will have to advise which I think is the best option. So the care route will be the best one for you. So get on board. Let us know. Drop us an email. Kemi, feel free to put an email address there. I'll put in your details there, Kemi, so that they can contact you, so they can discuss with you, and you talk to them on the personal level. What are the details? Tade said, I want to go with the caregiver. I'm currently in healthcare line, an auxiliary nurse. Yes, okay, into the IELTS exam training. After the exam, one next. Okay, that's fantastic. If when you are doing the exam training, the IELTS trainer, yeah, feel free to do that. But most important right is getting the job. We need to look at your CV and get your CV revamped. It's very important, and start applying for a job. There's really no time to waste, really. You could put your IELTS exam in view as if you're doing that, then with your experience itself, you are good enough, and the certificate you've gotten, you're good enough to start applying and start getting some jobs or some job offer. Is the course free? Are we to pay for it? Yes, the online certificate is. So what we do, we offer a package. So it's not just about the training we offer. The training is just one of the things that we do. So we do the trains, one of them. The general consultation and the whole process and guiding in the right direction is also very, very vital in this whole process. We do CV revamping, very, very important. We do the mock interviews. When you have an interview, it's very, very important as well. And the visa process. So it's not like just one thing you pay for and that's all. No, that's not how we work. We rather work with you closely, because we see your success is also our success itself. Habibat is asking, how do we evaluate my university degree to serve as proof of English? So if you have a degree taught in English language, I don't know where you schooled from. Is your university, is your country known for speaking English language? If it's that's the case. If you are in a country whereby you are mixed, maybe you are like in Cameroon or some other country whereby you schooled in the English part, then you need to get the further certifications from ACTIS just to corroborate that your degree is sufficient enough. But if you school for the largely popularly English-speaking country, your university degree should suffice. I don't think it's really cool. If you want to be more comfortable, you can get a letter from university just to say that. But I think if it's popularly not speaking English, then you should be okay. Patricia is asking, if people apply through you, would you give references for people already in the UK? So the reference I have a student already in the UK who asked for reference. I can give you a personal reference as if I've known you, I have a client who has asked me for that already, which I'll give you a personal reference. So no problem with that. Jane is asking, I'm actually got here late. Would you love to start from scratch? Are you for real? Who is Jane asking to start from the scratch? Sorry, Jane, I can't start from the scratch. Happy Bats asking, how do I reach out to you after this meeting? Kemi, do you want to share my number? Okay, let me put my number there. That's fine. That's 44. I'll just put in my. Sure, you have our details, right? Let me see. Sorry. I'll just put in a website address. Just typing in our contact details now, right? Yeah, so this is my number. We do have other representatives as well in Nigeria, so feel free to look at our website and reach out to them. Kemi, feel free and to share your other contact details. Let me see if I can share that as well. Just give me a sec. I just want to put in details there. You can feel free to reach out to her, and I'll read the questions in a sec. Just give me a minute. So reach out to, if you are based in, anyway, our first point of contact, you can speak with my colleague Kemi. Kemi is one of our consultants as well. We should be happy to take care of your other queries in case you have of them. Okay, so let's see. So let me look at other questions that you have. I'm just gonna read some other ones, so probably today. So I have others asking. I have a care certificate and first aid certificate from Red Cross. Is this relevant? Yes, it's very important. This certificate does come in very handy in this whole process. That's correct. Dollar is asking, I'm a registered nurse and midwife working in Nigeria presently. What do I have to do to work in the UK? I think I've covered that already. I don't want to recap myself in the whole process, so feel free to reach out to us for further guidance. But I think I've covered the whole process already. What tier level are we likely to be working at? So you're looking, everybody's asking. So you're looking at the skilled worker visa program. It's formerly tier 2 visa scheme. So it's you could say tier 2, but it's a skilled worker visa program. Osapolo is asking, how is the process like for a practicing doctor in Nigeria who wants to enter the UK via the healthcare system? Yes, I do have 1 or 2 doctors like that who are in the process, and feel free to reach out to me. Slightly different because you're a doctor already, and I looked at other schemes whereby you could come into, and the only one I can find is just a healthcare assistant. Actually, though I think you are more qualified for it. If you're looking at it, just like a gateway to enter into the country, but we'll have to look at your CV and do the CV revamping thing. Then just to from there we start applying for jobs. I had one already who applied within a week. He got a response. One of my friends, Dr. Latif, and he said that you meet all the requirements. The only thing left was you did not have a driver's license. So I told him, go and get your international driver's license. That was the only thing left for him. So once you get that, go back and tell them that you have the driver's license, which allows you to drive in the UK at least for 1 year, pending getting the full driver's license. So yes, so feel free to reach out to us. And Nig Tel is asking, how do we start the process? Please engage with us. The training is the first thing we do, or upon payment of the service charge anyways. Then you start the process. Reach out to Kemi and myself. We'll let you know more details in terms of the service charge. Omoyeni is asking, I've done the training and have certificate in care and have done IELTS exam. Fantastic. The only one thing left is a certificate of sponsorship. How can you help? Yes, that is very important. That is arguably the hardest aspect. We can definitely help you. So we run 2 things actually. So we try to look at job in the open market, because I know that at this competitive, but people are still getting jobs. But sometimes when you do on your own, sometimes you don't target the right roles. You just apply, and it's a lot of energy wasted. So we want to help you to target the right type of jobs that gives you your interview comes a lot quicker. That's the one area we will help you with. Because some of our clients, if you from a existing client, you will see that we do send job opportunities as much as we can. Every 2 weeks, every 2 to 3 weeks, we share new opportunities of new care homes who are getting their licenses. We share those information, and in some cases, we do have some care homes whereby we have kind of partner with more. actually. We have a few that we partner with already, and there are a few whereby is in the process of being finalized. So once we finalize this arrangement, we'll reach out to people who have shown interest. Some of them might come with additional fee, but if you show interest, we're happy to work with you and refer you to some of those agencies that we work with directly to. Okay. So it's asking me, and Mazin is asking, how do I get the care certificate training? Please send us an email. We were happy to run the care certificate training for you. It's what we do as part of the service. So I've just said that previously. I just reiterate that as well. That is part of the service. Is Kemi on the line? Can you please share our details of the service that we offer? Well, look at our website. It does capture all those information as regards on the website in terms of the service that we offer to our client. Just capture it. Let me see if it's Kemi's here. At this time, I say I'm a banker and have an ordinary diploma and also hold a degree from the Benin Republic. I was taught in English language and I have an English proficiency letter from school. Are you on the call? Can you respond on the chat? Respond on the chat with the service, okay? Respond online on this chat and ask some questions. So you respond, put a service charge. So you're a banker. You said you're asking to write the IELTS, and if no, what is the next step? So if you're a banker, what do you do? Because one of the roles in banking is there's no role like a banker as among the role for sponsorship. You're looking at roles like treasurers. You're looking at bank managers. You're looking like roles in qualified accountant. There's nothing like banker. And on the among the roles I look for sponsorship. So I need to know exactly what you do. Specific is very important. Yeah, from Benin Republic, I think Benin Republic is you actually mostly you have your IELTS. So you have your it's mainly if you're taught in English language and it's setting because Benin Republic is I think it's French speaking, right? So if that's the case, you might want to consider writing an IELTS or you get a waiver. If you have your letter from the university, you can need to submit to the body called ECTIS. They could now confirm and corroborate that yes, you don't need to write the IELTS, except you are very certain that yes, you can reach out to me directly to speak. Okay. How much is it for the package for a family coming to the UK as a carer? Reach out to me at Boss Today. We don't. If you have one person on the family, we don't really segregate. Most people have families, especially for a immediate family, they want to bring along with you to the UK. So irrespective of whether it's one person or family, we treat them as one person really because we just just one person, so to making a difference. Let us know. I'm happy to reach out to you there. Happy to discuss that. We're getting down to list now. So Tadi said I got an international passport with my father's name, and now I'm married. I have the opportunity to go with my spouse. How do I go about it since my surname is different? Yes, it's very common. I have one of my clients who just got a visa. It's the same thing, and she's married, obviously, so her certificate is not the same as the current certificate. What you need to do is just if you've done just get what they call it now. You can do this newspaper publication, but more importantly, do a sworn affidavit. Do an affidavit saying that this person, your previous name and this name, they are one and the same person, because you are now married. That solves it. Okay. Once you have that should cover it. What are your success rate? I think success rate is quite relative. This program is still up and running. A lot of my clients, I have about in Nigeria right now, I have about 5 or 6 who are currently in the process of getting their visa. So it's I think that is quite, for me, that's quite commendable. And we are growing in that area. It's growing. We are building more relationship with more and more of our clients. So yes, it's I would say it's a work in progress, and which I encourage you to come on board. Someone say, can I get my WhatsApp number? I'm calling from Rwanda, and I'd like to know more because I'm new here. Feel free to reach out. I put a number already on the chat. It's already there on the chat as well, on our company and also the website. You can feel free to reach out to that. Then reach out to my colleague Kenny, and we're happy to support you in that space. Paul is asking, how can we contact you? I came in late. Feel free to follow. I put in the contact details already. You can reach out to Kemi. I put in Kemi's number there. Reach out to me, and we can help you. Now the numbers are also already on the chat, so you can look at the details there. Messi is saying that my sister has 4 care training certificates from Florence Academy. Does she need to do another training? She might not. If it's relevant to care, she doesn't need to do another one. I know the way Florence work, just take one area, small area of care. Yeah, it could potentially be sufficient. You could work with that. But apart from that, we still need to do other things. So I have clients who already have the cases they already have the care training certificate. That is correct. And from a different academy we don't work with, but we can still bring them on board and support them in the next phase of the process in terms of the consultation, in terms of more of the job area, and general support for the CV revamping and the visa consultation. We can guide them on that other aspects. So it's simply just one thing, but a lot needs to happen. Okay. What are your challenges for facilitating this? I think I already covered this already. It varies depending on your current situation of things. So I will advise you to reach out to me, and it depends on where you are. Some people are just starting, some are looking at doctors, some engineers. So the fee tends to vary a bit, but we don't charge expensive. That one is set. So we don't charge service that we'll say no. That's one thing we pride ourselves if we don't charge expensive. So feel free to reach out to us to discuss further. I think I've covered the issue of IELTS as well. Is age relevant for the care job? Age is important because I think you mentioned me above 55, 50, 55, 55, we're getting quite old. Because the role involves physics, you need to be physically strong. I've seen care homes asking me, oh, I look for someone that is strong, tall, height, good build, and all. Because you're going to be holding people, holding an elderly person. If the person falls to the ground, for instance, you need to pick the person up. You need to be strong yourself. So that's the most important criteria. Asking about fees, I talked about fees reaching out to us. I'm a midwife. I'm a registered midwife. Do I need the IELTS? If you want to do an NMC, you need the full IELTS. Yes, I would encourage you to do that. If you want to work in the UK as a registered nurse, write the IELTS. If you want to come in via a different route, you might need to write the IELTS, but the score might be less. So feel free to reach out to us to discuss that. How long does the caregiver certificate valid last? The one we run doesn't have any necessary validity period. It doesn't have an expiry date, so to speak. Okay. Okay. What are the advantages of to get a care job if I come to UK with a tourist visa? That's a very good question. Thank you for Aisha for asking that question. If you come in with a tourist visa, does it give you any advantage? Maybe not. If you're in UK, doesn't mean that. But if you're in UK, you're going to put in. Like, I have a client who called me. I have one of my clients actually. He has applied for his visa right now. He came as a tourist visa. I recommended the client to one of my care homes we work with, and they allowed to practice with them, just a voluntary practice, and they were happy with the way he works, and just a voluntary basis. And they told me, John, I want to sponsor this person, and the person was sponsoring the person. The rest is history today. But it may not apply to everyone, because you have to go back to your home country to apply for the visa. You can't get it. You can't switch from tourist to a care visa or a skilled worker visa in the UK. It will help if you're in the UK. They will look at, okay, person in the UK, they'll call you for an interview, just maybe, but it doesn't necessarily easier. It doesn't make it any easier, because if they're not providing sponsorship, if they think you're in UK and you have a right to work and you're not providing sponsorship, then to making a difference. Okay, it's slightly easier, but slightly better, but it doesn't make so much of a difference, to be honest. Okay, is asking, I want to know the procedure on how to get a care visa. I'm based in Nigeria and I want to relocate. So I think I've elaborated on the process. If you joined earlier on, you would have seen the process. I think I elaborated on it extensively. So what we can do, if you missed out on it, okay, or Gloria, feel free to reach out to us directly again. We'll just recap it for you. Well, I think we've covered it and I don't want to go through the process of recapping because of time. Okay, so I think that's the last question for today. So I want to thank you, everyone. I see some hands are raised up. Aisha, Fatuma, and Gloria. I think I've addressed your questions on the chat. I can see your hands are raised. I want to think we've addressed your questions. Putting our email address, our website, our consultant Kemi is also there as well, and also myself. Feel free to reach out and have a chat. I've given you a basic foundation so you have a good idea of what the process entails. Feel free to reach out to us and let's have some further discussions. Let's make it happen for you. I think that is the most important thing for us. We want to see successes, and so that we can eat and dine, catch up again. I'm going to be meeting with some clients very soon who are coming to the UK next month or two, about 5 of them. So I'm very excited about that opportunity, about these guys coming in. So yes. So thank you everyone for today. I know it's in the short notice, so thank you once again. And please reach out to us and let's work together and let's make this happen for you. Thank you and God bless. Have a good evening and bye bye now. Feel free to say hello, bye bye, and we'll catch up soon. Okay, bye bye. We shall speak soon. Thank you very much, Douglas. Thank you, Babatunde. I appreciate that. Thank you so much. Thank you so much.
Thank you.
Thank you, Messiam. God bless you. Thank you very much, Messiam. Thank you for that. Thank you for your questions too. Thank you. Have a good evening. Thank you. Our details are there in the chat. Feel free to reach out to us. Okay. Bye bye now.
Bye bye.
Thank you, Aisha, for your questions. Bye bye.